Hi, everyone. Before we get into the new guest that we have for today, I want to take out the time to thank everyone for following us so far. It's been 15 episodes of bringing on guests from across different sectors of the economy to discuss with us. And you've reading with us through all of those episodes. You've liked, you've subscribed, you've commented. Thank you for your support as always. Today we have a very interesting guest with us in the person of Babatunde Adewumi, who is the founder and CEO of Quinta Health. Hello, everyone. Good day and welcome to another episode of Sustainability Matters. I'd like to introduce our very, very important guest in the person of Babatunde Adewumi. Please stop me anytime if I'm murdering your surname because I'm not Yoruba.
No, you got it
But
right.
Babatunde is the founder and CEO of Quinta Health, an organization dedicated to making breast and cervical cancer screening accessible to all. Thank you so much for joining us today, Babatunde. So, what would you like to be called? Babatunde, Tunde, what works for you?
Babatunde is fine.
Babatunde is fine. Awesome.
Yeah.
Just to give the viewers a bit of a background, Babatunde is not feeling so well today, and he has taken some much needed rest time to come on the show today. So, thank you very much for honoring us with your presence on the
Thank you.
platform. I feel like I've not done it good justice to what you do around Quinta Health. So, can you give us a bit of a background? What is Quinta Health about, and how did you come onto solving for cervical cancer, especially for women? Usually, when you hear stuff like this, you just expect a woman should be the one solving this problem, but you are a medical doctor who is passionate about women's health. How did you come about this passion that has developed into Quinta Health?
Okay. So thank you so much for having me on this program. Um. So the first thing is why am I interested in women's health? So I'm an only boy,
Mm-hmm.
and I'm surrounded by awesome women, my mother and my sisters,
Wow.
and I know how important women are in the lives of men and in the lives of
Mm.
everybody. Everybody needs a
Yes.
woman to help them in their life, basically. And I have these amazing people who are in my life, and why not? I'm not one of
Yeah.
those people who demonize women, because I know that there are awesome women that exist, and I have them
Mm.
around me, and that's
Yes.
one thing that keeps me going. That okay, if these women can surround me and they can support me, there are several other women who are surrounding people and supporting them out there, and they need to be saved.
Mm.
So Quinta Health started in
Mm.
2017, shortly after my NYSC.
Mm.
But prior to that time, I had a friend who lost her mom to cervical cancer in 2011 when I was in my third year of medical school. And I was so angry when I knew that she could actually not have died from cervical
Mm.
cancer. And when she died, the family went upside down. The husband died shortly after. The children had to
Wow.
struggle through school, and
Yeah.
it was like a roller coaster of terrible events for that family. And I felt that
Preventable.
yes, it's something that could have been prevented if she was
Mm.
vaccinated, if she was trained, if she was treated, if it was caught early also. So
Yeah.
that basically made me say, okay, I must like wage war against this cancer that is pretty preventable. So that was why we started Quinta Health in 2017, just after my NYC, and I felt, okay, let's start working and start seeing how we can um, reduce or eliminate cervical cancer in Nigeria. So
Mm.
that's
Amazing.
right.
Amazing. Before I go to my next question, I'd like to put it out there that based on the profile I've seen online, especially on one Young World's platform, I see that your organization has reached over 8,000 women and giving them some form of education on cervical cancer. So that's a big deal. But before you started to see this level of results, what was it like starting Quinta Health? I know you've given us your thought process, what you were thinking about, how this is an important problem to be solved. But what were the early days like, masterminding this kind of solution?
So I started in my in my what's it called, in my room in NY during
Mm-hmm.
NYC then. It was after NYC, but that was like the day of our passing out parade. So I had this person. I had volunteered for an organization called Go Touch of Life Foundation, and they
Yeah.
were working on cervical cancer.
Mm-hmm.
And I was the head of the volunteers at that particular
Mm.
point in time. So there's somebody we used to call Augustin. Augustin had given us like a pep talk and said, "You guys have learned skills. You've learned how to do cervical screening from our
Mm.
organization. So it will be good for you guys to actually go and
Mm.
replicate what we are doing where you are. And that's for anybody who has that dream to want to replicate this. I'm going to support you." So
Oh,
I just got to
amazing.
my room that day and I actually thought about it. And I said, okay, I'll start. And I reached out to Augusta Stanley and said, okay, I'm starting. And he paid
Stanley.
for our registration, our CAC
Yeah.
registration, because we started out as a social enterprise,
Mm-hmm.
hoping that we were going to like make some money and then at the same time do some things. So, but at that particular point in time, nobody knew me. I was just fresh out of med school, fresh out of NYC,
Yeah.
and I just wanted to like make a difference. But
Mm.
starting was actually very rough, basically
Right.
because people need to trust you before they can put
Mm.
their health in your hand. So I would pitch to people. They'll say, "Oh, you have a wonderful idea," but then nothing came out of it. So 2017, 2018, I was just doing pro bono work for people. In fact, I would go
Yeah.
for outreaches where nobody would even see me. I'll plan the outreach from beginning to the end. By the end of the day, I
Mm-hmm.
won't get anything out of it. So it was one of such outreaches that I did, and I posted it on LinkedIn. And then the the founder of Amen Foundation,
Okay.
which is an organization in Gombe State, saw what I did and asked me if I could come down to help us set up cervical cancer screening centers in Gombe. And I
Mm.
said, why not? So uh, we went to Gombe then, myself and one of the consultants on my team. And then we set
Mm.
up the cervical cancer screening center in Gombe. And after that, that was when we started going like upwards and people started trusting what we had done, seeing that
Mm.
we have the track record. And then we started like reaching out to more people. We started doing a program we called Market Waka at the time, and then
Mm.
go to markets, screen women for free, create awareness and all that. So and some of my friends were like, why don't you put the stuff that you are doing, why don't you put it on social media? I wasn't really like a social media person. I had all the pictures and everything. But then I was like, nah, I don't like the toxicity and the problems there. But then I, I had to like, okay, so I can't be doing something this amazing and then keep it under the table. So I started um, posting on social media. And in 2021, yes, I think it was 2021, a Aproko doctor saw what I was doing and asked us to work together. So that was when we did like an outreach in Lagos, 2 day outreach. Or yes, no, it was a 3 day outreach. And then we screened more than 400 women. The plan was to screen 100 women. We screened more than 400 women. And yeah, it's been awesome since then. But between 2017 and 2019, I had thought of stopping Quinta Health more than 10 times. Like I've always
Wow.
said, it's difficult. And every time I pitch to people, they say it's a nice idea, but it's a nice idea, and you guys are not like engaging me and all that. So basically,
Right.
it wasn't like smooth starting, but eventually, when people began to see what we were doing, they began to trust
Mm.
us more. Yeah, things got
Mm.
better.
Amazing, amazing story. Whenever I sit with founders, I like to dig into their starting, at least the first 2 3 years of starting, just to let people know that whatever it is you're seeing now in terms of results didn't start like that from the get go. One of the things I can say on your behalf, I don't know you personally in that sense, but I know you professionally through your work and how you're not shy about letting people know about what you're doing, especially on Twitter. If there's anybody that is passionate about this cause, it's you. But before we get into what cervical cancer is particularly and why it affects women, I'll just put this caveat out there that I didn't even know about cervical cancer until like 4 years ago. and I discovered it from my organization. It was not even, oh, there's a cervical cancer issue, please, can I go for screening or anything? It was my organization that brought it to me and said, and they said, do it, right? Even when I was doing the screening and all of that, I still didn't know what it was until I started to follow your page and I started to research more about it. And I'm pretty sure that there are thousands of women like me that I'm enlightened now, but still don't know what cervical cancer is. Can you give us like a brief overview of what cervical cancer is, especially as it relates to the female body, and why you think it's important for us to know what it is, screen, and then prevent it?
So you are very right. I'll start from the fact that some women don't even know where the cervix is in their body.
Mm,
Like I met someone recently, and the person was asking me, "Where's the cervix?" And like this person is supposed to be enlightened, and I was shocked. Like, and in my mind, I'm like, I have not even started work at all, because if a lady can actually be asking where the cervix is, then there is a lot of work still to be done.
mm,
So, and it's not people's fault. People are not doctors. People are not
right.
health professionals. Just hear
Mm-hmm.
cervix, like you can confuse it with, you hear cervical, it can be the bone of the neck or something. But when we talk about cervical cancer in this regard, we're talking about the opening of the womb. So the womb has
Mm-hmm.
like an opening. So when a woman goes to the hospital and they say she's 4 cm dilated, she's 8 cm dilated, she's fully dilated, that's the part that we are checking as doctors to know if the baby can come out. So that is the part where the baby comes out. So um the cervix opens. So let me just use my hand as an example. So if
Okay.
for instance this is the womb itself. So the cervix is like the opening and it protrudes. It's like 4 centimeters long in itself. So it comes out and that is where the baby passes through. So the womb
Mm,
holds the baby. The cervix is like the passage for the baby to come out. So that is where this cancer affects. So as small as that part is, that is where the cancer affects, and it affects every other part once it gets there. So we
mm,
know that cancer is an abnormal growth of cells in the
right.
body. Yes, so cervical cancer is abnormal growth of cells in the cervix. So in that particular part of that body, and it is
Mm,
caused by human papilloma virus, basically, and it's a virus that is gotten via sexual intercourse. Now,
okay.
a lot of people will say people who get HPV are promiscuous, and that's one of the problems that we have. That's not true.
Mm,
You might not be promiscuous and have what's it called, the HPV virus. Now,
okay.
for 90% of the people who have HPV, the body clears it, but 10% it causes changes in the cervix and then eventually leads to cervical cancer. But this
Mm,
cancer is actually very preventable, and
mm,
there are several stages. Once you are vaccinated against this cancer, you will not have it. Against
mm,
this virus, rather, the human papilloma virus. This morning, a friend of mine sent me an article about is it Scotland? Yes, Scotland. They did a study, and women who have been vaccinated between 1978 and 1996, they have followed them
mm.
through, and none of them has had cervical cancer up till now.
Amazing.
Yeah, so like the same study was done in the UK, the same study was done in Australia. So for every one of those women who were vaccinated, none of them have had cervical cancer up until now. So
Mm,
vaccination is a potent way to actually stop this cancer. The second way is to screen and treat. So when you screen a woman for cervical cancer, what we are trying to look for is cervical dysplasia. Dysplasia is a precancerous lesion that is caused by
mm,
changes that this virus does in the cervix. So once we catch that change early, we call that change a dysplasia. Once we catch that change early, we treat the woman and then she's fine. Recently, we did an outreach
mm,
in Lagos, and one of the people that was screened and we treated was very, very agitated, and she was saying, "Oh, she needs to rescreen after 6 weeks." Blah blah blah. Yada, yada. I
mm,
was like, "Okay, you can go and do your screening. and then come give us the result and let us know what. So she did her screening, and after we had screened and treated her, and she
Mm.
returned negative. She was so excited and she was like, God bless you, God bless your team, blah, 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 and all that. So those are the levels that which we can catch this cancer and then we can treat them.
Yeah.
So it's not like a cancer that we say, oh, we don't know what causes it. We know what causes it. We
Mm.
know how to attack it and we know how to treat
Mm.
it before it actually becomes a full blown cancer.
My question from all of this is, sorry.
Thank you.
This HPV is only common, or is only this virus HPV only comes up in women that are already sexually active. Is that correct? Is my bias correct?
Yes, correct. Correct.
Okay. Okay. So as long as a young woman becomes sexually active, you must start to prioritize your HPV screening.
Yes. Yes.
Okay, young ladies that are not sexually active yet have no business with screening for HPV. But the moment you start to have intercourse, HPV screening is a must.
Yes, it is.
Okay,
So
okay.
basically, the
Mm,
we usually say that women should start screening from the age of 21.
mm,
So
okay.
from the age of 21, it's believed that, oh, this person will probably have been sexually active. So
Mm,
that is the age. But for me, I usually say that anybody who has been sexually active should screen because you don't know. It takes between 10 and 15 years for the virus to appear in your body and then for you to have
mhm,
the dysplasia and then progresses to cancer. But I have seen this virus active. I've seen a
mm.
dysplasia in an 18-year-old. So it
Wow.
means maybe they've started like abusing that person from like maybe the age of
Mm,
8 or a younger age. So that is why I'm always hammering that women who would have the screening should be those who have been sexually active. And if anybody knows that they've been sexually active very early, because early age at sex is actually one of the risk factors for this cancer. So because
mm.
it just makes sense that if you have been having sex pretty early, then you will be exposed to the virus and then possibly have the cancer. So early age at sex is a very high risk factor. And that is why it's very important that we say to people that if you've had sex, then you should prioritize screening.
Your HPV screening. I absolutely agree with you. And what the work you're doing is actually very important because if we limit it to the age of 21, we have younger women below 21 that may be sexually active for different reasons. So I also think we need to demystify the shame around going for screenings like this. Is this screening free? Do people just go into a hospital and say, I want to get my HPV screening on a normal day? What's the process like?
So it's not free, but my organization does it for free.
Mm,
Like for when we do our screenings, we have tried at a particular point in time to say women should pay, but you discover that when you say people should pay, they don't come. So it should be free. Like governments should actually make it free. In countries like
mm,
UK, Australia, Canada,
mm,
um, even the US, these screenings are free. They call women to like
mm,
come to do their screenings. So if you have met anybody who migrated from Nigeria to the UK, they'll tell you that they send them mails all the time. Like I get this all the time on Twitter. Like when people migrate from Nigeria to the UK, they
yeah.
always say, Dr. Babs, all this your cervical cancer screening, you have pursued us to the UK. Like they make it compulsory for ladies between the ages of 21 and 45 to actually get those screenings done. So if you get into their system and you have not done it, then they will force you
Mm,
to actually do it. So it should be free. But in Nigeria, it's not free. But there are organizations that actually make it like very affordable for you to be able to
mm,
do. But one thing I can say is I will not promote any organization here. I would say that you should go to every teaching hospital. Every teaching hospital in Nigeria will do a pap smear for you. So if you go to any teaching hospital in Nigeria and you say you want to
mm.
get a pap smear done, you get it done. And then you get your results in like 2 weeks thereabouts. So it's not free, but it's not as expensive as you having cancer. So
Mm,
I think the
I
last
agree.
price that I heard about is I think about 15,000 naira. So
Mhm.
People should
That's fair.
try as much as possible.
Very,
Yes, it's not very expensive
very
for something that can save you from cancer. So
right. Amazing, amazing. So, what's the most rewarding part of this journey for you? Because what I'm hearing is that it has started as a social enterprise. What you started it as was a social enterprise, and then it has kind of evolved into an NGO. Is that correct?
yes, yes, we are registered as an NGO now.
An NGO now. And I know there's been like a lot of challenges on the way, but what has been the most rewarding part of this journey for you? Because you've been at this for how many years? Over 7 years now.
Yeah.
Yeah.
So reward for me is seeing the women come for the screening, and
Mm,
then we catch a positive case and we treat it. So I know that that woman has been saved from cervical cancer. So that's the reward
yeah.
for me. That's what fuels my passion. I'm always happy to go for screenings, and I'm always happy when we catch a positive case of cervical cancer. And for me, that is what's much more than money to me. There was a day I was just putting it on Twitter and just calculating like how much we have saved the government, and it was going to over 200 million naira.
Wow.
The amount of screenings that we have done, if you calculate now, we've done 8,600 screenings so far. If you want
Yeah.
to multiply 8,600 by 15,000 naira, know
Mm,
how much that is going to cost. So it's actually
mm,
for me, it's that is the most rewarding, basically, like that women get
yeah.
screening, yes, and then recently we advocated. I was always shouting on Twitter that we must get this
Yeah.
vaccination, and now girls between the ages of 9 and 15 would get these vaccinations for free in Nigeria. Over,
Amazing.
I think, over 10 million doses of the vaccine was distributed um, between last year and now to women, to young girls between the ages of 6 and 9 and 15. And yes, I'm happy
Mm,
that people are beginning to listen to the government is beginning
yeah.
to listen to what we are saying, and is beginning to yield a positive result. So
Mm,
very very happy that this is coming to fruition. So for me, the most rewarding part is that women come, they do the screening, and they go. We are happy to always have them.
yeah. Amazing. And I agree with you that ideally should be the most rewarding part, like you said. But you building a solution around healthcare, and let's even say healthcare that is profitable in a sense also has its challenge. But you're building something in an NGO format, right? In the healthcare space, what has been the biggest challenge for you so far during the past 7 years building the solution?
So the major challenge for me basically has been funding. We've not
Mm,
been able to get grants. So most of when we started, I used to use my money, my personal funds to do this. At
tell
a
me
point,
about.
my guys were like, no, we support you. Stop using your money. We need you to also do
Mm,
things with your own money. And at a point, my volunteers banned me from spending my money on the organization. That if the organization cannot raise funds for itself, then we are not going to do any screening. But I still did not listen. We just had to like the first set of equipment that we bought was my personal money. So I had done some work and I felt okay. Let me infuse this money into the work that we are doing.
mm,
So that's been the major challenge that we've had, but we've been solving this by partnering with people, organizations that have like similar interests with us, and we are trying to also ensure that we see if we could get grants to continue to do the work that we are doing. So if I have
mm,
like endless money now, all I'll just do is keep setting up screening centers, keep screening women. But it's not easy to just come by money like that. So that has
mm.
like been the major challenge that we've really had. Apart from that, every other thing that has come um has not been a challenge because we always find a way to solve some of the problems that we have. But this money problem, everybody's trying to solve it.
Yeah, I
So
agree. I agree.
yeah,
It's not particular to Quinta Health. It's a general problem we're all
yeah,
experiencing.
exactly.
Right? But the work you're doing is actually very important. So I think with the momentum you've gained so far and the way you're very loud about what you're doing, it's just a matter of time. It's a matter of time. I see
Yeah.
that because I follow you on social media as well. I see that you've been on One Young World. I hope I got that correctly.
Yeah.
You've had several like successful partnerships. Can you walk us through some of the milestones you've achieved so far in the last 7 years? Because there may be people listening to this that say, okay, this organization is in the right path. I want to partner with them. So what are these milestones that you're most proud of that has given you the pat on the shoulder that I'm doing the right thing?
Okay, so we have screened 8,600 women for both breast and cervical cancer. We've treated 787 women for cervical
Wow.
dysplasia, and we have been able to deliver 500 doses of the HPV vaccine to women across Nigeria. We have also been able to reach out to millions of women,
Mm,
let me just say millions of people rather, through social media, physical
mm,
meetings, and all that, to educate them on female sexual and reproductive health, but with specific focus on breast and cervical cancer screening. So
yeah.
those are the things that we've been able to do. And yes, recently our work got
Mm,
a recognition from the One Young World. I applied for the fellowship in Canada recently. So I just got back from that
mm,
event where we had the opportunity on a global scale to talk about the work we are doing and to also spotlight the challenges of women in Nigeria
mm,
as it relates to female sexual and reproductive health, especially in the area of breast and cervical cancer. So I got a
mm,
sponsorship from AstraZeneca as a young
mm,
health as a young health impact fellow, young health program impact fellow 2024. So AstraZeneca sponsored me, and I got to go for the One Young World Summit in Montreal. So those have been like our major milestones as an organization, and the organization has gotten like a few awards from individuals and also other organizations who are passionate about the things that we do. So, so far
mm.
so good. We also have more than 100 volunteers working in the organization, and a lot of people still want to volunteer for us. But we are just trying to like say, okay, let us manage the volunteer space so that we have the people that we are sure of. So it's actually been a jolly good ride because people are seeing what we are doing and they are appreciating it.
Yeah, amazing. And I promise you, the work you're doing is important because I am around a lot of women. I am also a woman, and I know that there's not as much knowledge on this issue as there should be. Like a lot of people do not know enough about it. So the work you're doing is important, and keeping at it in the next 5 years, I'm sure the right audience will come through. So well done to you and your team,
Thank
Babatunde. How important is it for men to join this conversation in amplifying the need for this screenings, this prevention? Because when you say women's health, sometimes people want to confine it to just women's advocacy. But how important is it for men to join this conversation, amplifying voices?
So I think that men should actually be the ones leading the conversation.
Mm,
Shouldn't be left to women to actually do. Um, because men actually have like the means, the resources, and
mm.
the willpower to be able to push things. I'm not saying that women don't have that, but then
They'll
it's
find
not easy
you.
for you to just see a woman waking up and saying, I want to go into a bush for an outreach today. She'll first think of her safety, think about the family and all that. So, and I
From
think
there,
that also, yeah, I also think that um, if men actually are the ones pushing these narratives and they are
mm,
pushing the messages, then we'll have less abuse of women from men. Would have men who will be more empathetic, who show more
right.
empathy about female sexual and reproductive health. I see a lot of women say men should never be in this space. I've had a lot of people insult me. In fact, somebody told me that she wishes that I die because I'm working
Ah,
on female sexual and reproductive health. Yes, a lot of
you
people
should
have
do the
called me
work.
pervert, called me several sorts of names, but I just feel that it is misguided Like I know that there are terrible men out there, and I won't mind words calling out like very terrible men. But I feel that one of the reasons why we have terrible men out there is that because they do not understand like the pain and the challenges that women go through, especially with their
Mm,
health, because women actually have like a very delicate health health balance. And what do I
mm,
mean by that? Men do not need to pay attention to a lot of things. I can stress myself from now till tomorrow. Probably the only thing that will happen to me is that I'll fall sick. I'll take medications and I'll be
mm.
fine. But if a woman stresses
Yeah.
herself now, she will begin to have maybe reduced menstruation or very heavy
Mm,
menstruation or
yeah.
several other things. There are so many things that can happen to a woman if the delicate balance, if there's a shift in the delicate balance of the health of a woman. So I feel that men actually should be more involved, because if a man is more involved, a man will remind his wife, his family members to go and do their cervical cancer screening. Because when I asked my mom to go and do a cervical cancer screening, it was a tug of war. We were fighting. Like, you have to go and do it. She was like, what? I don't have cancer. I say, I can't be the face of cervical cancer out there, and
Yeah.
then you tell me that you don't want to do your screening. You have to do it. So she had to
Mm,
go and do the screening. When she came back and her result was negative, she was like, oh, thank you for letting me go do it. So if I was not like in the know of everything and like forced her to go do it, then would she have done it?
mm,
The answer is no. So men should actually be at the center of ensuring that women's health is actually protected, because in the
yeah.
natural events of things, God has made men the head, and men should actually take that position, not just to say, oh, I'm the man of the house, but they should also say,
Mm,
oh, my wife, oh yeah, have you done this? Have you done that? So men should actually
right.
know a lot about female sexual and reproductive health, and I think that is what will help us solve these problems.
Mm. I like that perspective because I would have to agree with you that if men knew or were more enlightened on some of the physical challenges that women go through in their bodies, they can now like show more empathy and less abuse in that sense. Thank you very much. So, what is in the short and long term plan for Quinta Health? Let's say in the next 3 years, next 5 years, where are you seeing Quinta Health going to in that time?
Okay, so there's only one thing that's our focus, to ensure that we eradicate cervical cancer in Nigeria, and we will continue to like be the voice for every woman who have not had access to screening, vaccination, and treatment in that regard, and we'll continue to like create the awareness. So, as it stands now, we are out
Mm-hmm.
there hunting for partners to set up permanent screening centers across Nigeria, and to also continue to do our outreaches in across Nigeria. So in the next 3 years, in the next 5 years, hopefully we have been able to set up screening centers in all states of Nigeria, or in all the local governments of Nigeria, if we really get a huge grants to be able to do that. So setting up
Yeah.
776 screening centers will be like our goal in the long term, and ensure that
Mm,
every woman in Nigeria is within a walking distance to a
mm.
screening center, or within just a cab drop to a screening center, and to ensure that every woman has access and every woman has the knowledge of what cervical cancer is.
Amazing. I'm already inspired. Amazing. And I'm sure with the amount of work you're putting in and the grace of God, you get to that height. So, what's one, as we're rounding this up, what's one myth about cervical cancer or the women's reproductive system that you would like to debunk? Because a lot of people have different ideologies about what you're doing around cervical cancer. So, help us debunk one myth that you've heard before.
Now, myths about cervical cancer. Well, I don't think there are lots of myths about cervical cancer, but there's a favorite one that I like to debunk, that there's nothing called toilet infection.
You that is very personal to you to debunk that thing. You
Very
qualified every day of
personal.
that because of it.
Very personal. Like, there's nothing called toilet infection. It's not the toilet that is causing the infection. It's so many other things that you are doing, holding your pee and not wanting to use that dirty toilet, not drinking enough water, Because when people travel, they are not comfortable. They don't want to drink water so that they will not use the toilet that they claim is dirty,
Mm.
right? So when you hold your pee, it causes you to have urinary tract infection. So you come back
Mm.
from that travel, and then you say, "Oh, because I used that toilet once, that is why I began to have that." It's not. It's not it. So there's something called toilet infection. You can get infections from the toilet, but it's not that kind of infection that is down there that you are getting from the toilet. The toilet is not powerful enough. It's not intimate enough to actually give you that kind of infection.
So regardless of the amount of how dirty the toilet is, it's not enough to give you an infection. That's what you're saying.
Yes, but I'm not supporting the use of dirty toilets. But
Okay.
yeah, a lot of people will say, "Oh, because I use somebody else's toilet, the toilet is not even dirty."
Mm.
Oh. They'll say, "I use somebody else's toilet. That's why
Oh,
I have
okay. Fair,
infection." So it's
fair
not the
enough.
toilet. Mm,
Fair enough. Fair enough.
yeah.
What has leading this organization, at least for the last over 7 years now, done for you, especially as a leader? I, for one, know that the most difficult part of leading is managing people. And like you just shared, you have over 100 volunteers now, and then you're speaking to women on a daily basis, trying to help them. What has been like the most growing part of leading this initiative for you personally?
Okay, so I have learned how to firstly delegate duties and
Mm-hmm.
trust people to be able to do things in my absence. I've also learned how um, to care for people more because like all my
Mm.
volunteers are like family to me. I'm involved in the lives of almost every one of them. So I know them by name. I know
Mm.
what is happening to them part time, and they always like would come to me, and like I see myself as an example to them. So if I want to behave in a certain way, I think that there are people that are looking up to me, and I need to compose myself and comport myself. So it's helped me to develop as a person, and also helped me to be able to like create like a family. So right now, if I want to do like an outreach now, I don't have to be there for it to be successful. In fact, most of the times I tell them you don't need me. So if I go for outreaches now, I'm busy snapping pictures, connecting with
Uh-huh.
people, and
Yeah.
trying to like solve the major organizational problem, not like really
Problem.
screening by myself. So it has helped me to be able to like develop more people. I've been able to replicate myself in quite a number of people that are working with me. So I have no fear in the future of cervical cancer screening in Nigeria, even if I'm no longer involved in it, because yes, I have replicated quite a number of people that would have the same passion or that has the same
Yeah.
passion as I do.
Amazing. Amazing. And I feel like we've done the most difficult job of a leader, trying to make sure that there's succession plans. If I'm not available, doesn't mean that the entire vision that we're trying to build collapses, which is amazing. Well done. It also means that you're putting sustainability initiatives into the solution you're building, which is amazing and cool. So well done again. What
Thank you.
advice, as we wrap this up, what advice do you have for probably a young boy or a young girl watching this and saying, I have this idea that's going to solve so and so problem. I don't know where to start, or I even have started, but I'm tired and I want to push it aside. As someone who has been doing your solution, Quinta Health, for quite an amount of years, I'm sure you have an advice for someone that's about to give up on maybe an initiative they're building. Please go ahead.
Okay, so I just use three words just to do it. Like
Ha.
it might sound cliche, but if I did not start what I was working on, then I wouldn't have been able to know that I have the ability to actually do it. So the
Mm.
simple thing is just do it. And good things, excellent things, great things, they don't come easy. You need to actually build like a very solid foundation. And in building those foundation comes the numerous failures that you are going to experience, comes numerous challenges that you are going to have to surmount. So it's just very important that we lots of young people want things to go fast. Nothing actually really goes fast like that. It only goes fast for like a few people. And
Yeah.
those people are just like select people. Like just happens by chance. But if you want to
Mm,
build something, it takes time. It takes quite a number of time. Like in
yeah,
2017, nobody really knew who I was or what Quinta Health
right.
was. There was a time I tweeted, like I always go back to that tweet and laugh. I tweeted, I'm like, I'm genuine. People should listen to me. I'm like, I was frustrated that day. I had to tweet that, guys, I'm genuine now. Like, but now I don't have
Yeah.
to tweet. I don't have to tweet that I'm genuine. If you like, take me that I'm genuine. If you like, don't take me that I'm genuine. Like people who have
The work
experienced
speaks for
my
you
work.
now.
Exactly. So people who have experienced my work, who have seen the work that we have done, take it to say, oh yes, this person is legit and is genuine. So it's not easy to actually build. It's very, very difficult. But that does not mean you should stop because the people that are doing it, they don't have two heads. So just do it. Like just do it.
Mm, I didn't plan for this, but the question just came to me as you were speaking earlier. Um,
Mhm.
in your opinion now, when is a good time to give up on an idea? I don't know if the question is
Great,
clear.
a
Let's say
great
you've been
time to give up on
pushing.
an idea.
Yes, when is the great time to say, okay, maybe I'm not the person to solve for this, or maybe it's not the right time to solve for this? When is a good time to say, okay, let me let this rest, let me let it go?
I'll say never.
Mm,
You can still keep pushing and do some other things, but never give up on an idea because it's not working. If the person that gave up, that did electricity or the bulb, gave up at the night, I think they said he tried 99 times before he could get it. If he had given up at the 75th time, he probably won't be the face of developing it. Somebody would have probably picked it up because developing an idea and working on something is like you are digging. Let me just use like you are digging a well, and then you kept on digging, you didn't meet water, and then you now abandoned it. Somebody comes there and digs for like 2 hours, and then now meets water. Nobody will remember the person who started digging. They will remember the
right.
person who met it. So for me, never is the time to actually give up on an idea. And like there's no idea that is too highfalutin. That's the truth.
Mm,
Because extraordinary things don't come from just you doing normal things. Extraordinary things come from you doing like something out of this world. And something out of this
mm,
world does not come very easy. So when you see people like excelling and doing excellent things in their lives, it didn't come easy. So and they have been working very hard. Like, so if I had given up on Quinta Health now, somebody else would have probably done what I'm doing at the moment.
yeah,
But
yeah.
it wouldn't be me. And then I would look at that idea and say, and I have that idea, oh, but I left it alone. So
Mm,
I think never is the time to give up on an idea.
amazing. Perfect. That was a perfect response. Thank you so much, Babatunde. How
Thank
can
you.
people support people like myself? I support in the way I can now. Whenever I see your post, I first retweet before I read. So how can other people who are watching this say, I want to support the work, this important work that Quinta Health is doing currently?
Just gather 100 women and tell us to come and screen them and pay for the screening of 100 women. Um,
Yeah, I agree.
yes, just gather
I,
100 women and say, okay, oh, Quinta Health, come and screen 100 women, and I'll be paying for it. So for us, basically, we just want to we just want to touch women's lives. We just
do
want
the
to
work.
ensure that no woman dies from cervical cancer. So, and if you are rich enough, or you know somebody who is rich enough, so that wants to set up a screening center in his local government, just choose one of the primary healthcare centers. We don't need to build. We just train the nurses and would teach them how to do the screening, how to do the treatment, and
Mm,
we are up to go. So anybody who is interested in saving women can reach out to us. We are willing to collaborate and work with anybody that that.
you've heard it from him, so please look out for, or in case you're even a level executive when you're interested in running this in your organization. Because I learned about cervical cancer from my organization as well. So reach out to me. Where can people find you? Say, oh, I have this idea. I want to reach out to Babatunde. Where can they find you?
Okay, so you can just look out for Dr. Babatunde on Twitter.
Mm-hmm.
My handle is at ENODAMADE. So it's just like people ask me the meaning of that. It's Enoch Damilola Adewumi. So I picked the first
Uh,
3 letters of all that.
uh,
So ENODAMADE. So That's my handle on Twitter. On Instagram is at Adewumi Enoch. The Adewumi does not have an N, so it's Adewumi Enoch. So on what's the name of TikTok? Yes, is at ENODMADE. So on TikTok. So Facebook is also Adewumi Enoch. I
Mm-hmm.
think those are all the social media. Okay, yes, on LinkedIn, you can just check for Adewumi Babatunde on LinkedIn.
Mm.
So those are my social media handles, and you can reach me on anywhere you can.
Yeah,
Yeah.
you heard it. You can also look out for Quinta Health.
Yes,
I'm sure
Quinta
you guys
Health.
will.
Yes, all our social media handles is at Quinta Health. At Quinta
Mm.
Health.
Amazing, amazing. Thank you so much, Babatunde, for coming on the show today.
It's my pleasure.
Considering the circumstances, you're not feeling too well and you still took out time to come on this. So thank you very much. We at Sustainability Matters wish you all the best in your endeavors, and we're very much available to support in any way you need us to lend our voices as well. To everyone watching this and if they're interested to know more about cervical cancer, please follow him across all social media platforms. He's very, very vocal about it. So I'm sure you will learn a thing or two. Until next time, or do you have any closing words for our viewers? Let me not take that from you.
Well, get screened for cervical cancer. I
You
think
heard it.
that's
I'm sure this is my wake up screen. Both today are like screening. Do you see yourself doing this like full time in the future? Do you see yourself doing this full time?
um, I'm not sure. In the future, I want to be
Mm.
traveling around the world, so that's what I see myself doing.
In the future, not setting up screening centers again. We're
No,
suspecting
no, we
you.
set up screening centers, but then I want to retire early because I would have built enough people to do it. So I just monitor what they
That
do. Yeah,
love
so
that. Love that.
basically.
I'm obsessed with the fact that you're very focused on replicating the ideologies you have to other people. If not, you die of burnout. So it's amazing that you're thinking that far already. Thank you so much, Babatunde. As always, this is
Thank
Sustainability
you.
Matters. If you've stayed this long on the show, it means that you've enjoyed what you hear. So subscribe, like, leave a comment, follow Babatunde across all social media as well. The work he's doing is really important and it saves lives. So thank you so much. Until next time, stay green and stay safe. Bye bye.
Bye.